There are not a lot of medications that low dose naltrexone interacts with, which is just such a, such a fantastic thing about the medication itself. If you have patients on, opioids or whatnot, there is, that does need to be monitored. But I would love for Shalan to dive into the ketamine information. He really is an expert in care with ketamine. So
yeah, this is just a straightforward question. Like Andrea stated, low dose naltrexone will barely interact with anything else. It's in the name, low dose. It is at such a low systemic serum level that it usually does not result in any significant side effects, nor with any sort of drug interactions. One thing that you don't take low dose naltrexone with is if a patient is on opioid therapy, if they're using opioids for chronic pain, obviously they should not be using LDN. They're just opposed in their mechanisms. Ketamine can be very useful in these patients. It can be especially useful in getting patients decrease their dependence on opioids. Eventually, if they're off them, they can be on LDN itself, which will help through neuroinflammatory pathways and oversensitization of central nervous system nerves and help with the pain. But it will not directly interact with the ketamine. So those could be used concomitantly.
But if you're a patient and you are on opioids for pain, 8 years ago, I think they started using ultra low dose naltrexone alongside of the opioids, which made the opioids more effective. And then it was a case of titrating the opioids down and the ultra low dose up until they got to a low dose.
Yes, I'm glad you brought that up. This would be a new indication for the naltrexone. It's not even considered low dose. Like you said, the term is ultra low dose. It is much, much lower than low dose, and it works through a different mechanism. It is actually shown this sort of like this brief insult on the opioid receptors does something whereby you have fewer side effects or fewer adverse effects that come through the opioid therapy. And paradoxically, it can improve the sensitivity of the opioid treatment. So you don't have as much of a reliance on the higher doses. Opioid treatment is quite tricky, and sometimes it can cause a hyperalgesia, where if you keep pushing the dose up, it just makes you much more sensitive to the pain. Having ultra low dose naltrexone on that regimen can help sort of counter that.
I've known many people that have come off of opioids, which some of them were on a cocktail of different opioids, and it wasn't doing anything for the pain. They were still a 9 or a 10 every day. And they managed to wean off of the opioids and just stay on LDN without going through withdrawal. And I think that is just absolutely amazing, because if you've been on opioids for, say, 20 years, the number of people that I've spoken to, even though they know the opioid isn't working, they're frightened of coming off. They're really scared and frightened to even wean off. So it's really something that people can try, with hopefully doing it, as Andrea was saying, and Megan, that you start low and go slow, and it's being patient with it to come off of the opioids.
Yeah, and the ultra low dose that Shalan was talking about, there was a clinical study done using 0.125 milligrams and also 0.25 milligrams were the two different dosages of ultra low dose naltrexone. And they compared those against placebo for patients who were using methadone in order to wean off of opioid therapy. And they found that the patients who were using either one of those doses of ultra low dose had lower withdrawal scores than the patients who were just using placebo alone. There's clinical data out there that shows, Linda, like you were saying, that ultra low dose naltrexone, can be beneficial in weaning off of opioid medications.
Yeah, Linda might add that there is also a lot of potential in using low-dose ketamine to get these patients off of opioid dependence. So I think that would be a good sort of twin arm approach where you're using ultra low-dose naltrexone and you're using low dose ketamine to address that problem, it can be a difficult beast to tackle. So, yeah.
And with your pharmacy and your understanding of molecules and all the compounding, etc., you would be able to help and support patients alongside of their doctors understand how to titrate one up and down, do some hand holding and answering questions.
Yeah, absolutely. We actually have a very incredible product for our low dose naltrexone. We call it a flex dose tablet. So it's a tablet that very easily splits into 4 pieces. It's going to allow for proper titration. This dose ranges from 1.5 up to about 8 milligrams. We have a few different dosages in there, including the standard 4.5. But it's going to allow a patient to titrate their dose as they see necessary, most often titrating about once a week. Sometimes every other, it might take 2 weeks. That's going to help mitigate some of the side effects and whatnot as they're increasing to the 4.5 milligram.
And of course, 4.5 isn't the right dose for everybody. Some people, you know, a lower dose is their sweet spot. Some have higher.
Yeah, absolutely. And that's why, that's why we've created these products in, such a wide range of doses to allow for a very easy dosages of 0.25 or right around 0.25 all the way up to an 8 milligram tablet, which is, really a fantastic option in some situations as well. I just mentioned the 4.5 as that's kind of a standard that's often seen.